issue at the university, especially when it comes to health benefits.
A town hall got heated today as Purdue's chief financial officer answered some questions about health care changes. Some say unionizing may be their best option.
The thing I've heard a lot in the last couple of weeks from almost everyone I've talked to is unionizing, collective bargaining power.
Robin Mallow got 77 letters from the Purdue English department complaining about the university's new health care changes. She's the department's senator and is disappointed in Purdue's transparency.
We're not consulted about virtually any major decision that affects the entire campus.
Purdue CFO Bill Sullivan doesn't agree. That's why he came to the town hall.
We're all about transparency, despite what some people in the crowd today don't think is very transparent.
Sullivan explained why the university needs to do things like increase premiums by 6%.
If you look over the last 5 years, the employee share of the cost has remained essentially flat, whereas the university share of the cost has increased substantially.
Purdue says its employees' annual premium averages $1,500 less than local employers. But many in the audience don't feel that's a fair comparison. They want Purdue to look at other Big Ten university health care plans.
If we're not comparing to our peer institutions, the very people who would employ many of us should we choose to leave, then Purdue is essentially kneecapping itself in terms of maintaining faculty and staff morale, in terms of retaining and recruiting.
Sullivan says the comparison to local employers is fair due to the number of staff not directly related to higher education. There are 12,000 employees, 9,000 are staff, and only 3,000 are faculty.
And that's why the numbers I put up today reference the local economy.
Some asked if unfreezing tuition might help with healthcare costs.
I'm not going to touch unfreezing tuition. I think there's a lot of different things we should look at.
He says they will look at other options, especially what to do about working spousal benefits. Mallow hopes they are more inclusive this time around.
It's time for us to have a serious conversation about what we want this university to look like. It can be so much better than it is. It doesn't have to be a place that is depressing to work at. And it's sometimes depressing to work at because it feels like it is bad thing after bad thing after cut after cut.
Well, Sullivan says any health care decisions made would not go into effect until January of 2020.
Well, state regulators will take comments from the public on a rate hike request.